Hey, this is Dr. Osborne with Gluten Free Society. Today in our Gluten Free Research Update, I've got a great paper I wanted to share with you. Um, the authors of this paper recently published in Expert Review of Clinical Immunology the title Going Gluten Free in Non-Celiac Autoimmune Disease, basically people that have autoimmune disease but not celiac disease, right? And these authors in this review are calling this a potential missing ingredient, meaning something that's very, very important for these individuals to find with autoimmune disease to actually find improvement. So kind of in summary, we won't dive into the deep science of this, but I want to share with you, like, if we look at some of the different conditions in this review that have been shown to respond to a gluten-free diet. Again, these are non-celiac conditions. So if you know somebody that you love, you've got a family member, or if you yourself are struggling with any of these different conditions, very, very important that you pay attention. So what we see here, kidney disease, membrane proliferative glomerulonephritis. In essence, for many people, there's a type of IgA nephropathy or a type of kidney disease, right, that is autoimmune in nature that people who go gluten-free tend to respond favorably. In essence, going gluten-free helps their kidney disease start to heal and go into recovery. Also, hepatic conditions or liver conditions, predominantly something known as autoimmune hepatitis. There are a lot of other names for this: primary sclerosing cholangitis, primary biliary cirrhosis, primary biliary cholangitis. So if you've got an unknown or well, maybe you've got a diagnosis of liver disease, some form of chronic liver, fatty liver, etc., you need to look at the gluten-free diet as a potential to really help you overcome this condition. Another group of conditions are the neurological and psychiatric entities: peripheral neuropathy, Guillain-Barré syndrome, neutrophilic polymyositis, myopathy, schizophrenia, or other associated mental disorders like bipolar have actually been improved as a result of gluten-free diets. There's a number of research studies showing that these individuals, especially with schizophrenia, actually have antibodies to gliadin or gluten. So very, very important, again, neurological conditions that are non-celiac that can respond to a gluten-free diet. Cardiac disease is the next in this list. Autoimmune myocarditis. See, a lot of people don't even realize that many forms of heart disease are autoimmune. It's just not talked about. The cardiologist doesn't really consider the risk of myocardial infarction to be anything related to autoimmune disease, at least none that I've spoken with, minus Jack Wolfson, who, if you know Dr. Wolfson, the paleocardiologist, great guy, you should check him out. Now, what that means, you understand that cardiac disease or heart disease is the second, and some would argue the top killer in the U.S. in industrialized countries next to cancer. So if you've got a form of cardiovascular disease, you might want to consider a gluten-free diet. It very well could help you, especially if you've got a form of inflammation around the heart or inflammation around the sac of the heart, which is what these conditions are referring to. Skin disease, dermatological disease, things like predominantly, now most of you might know that there's a condition called dermatitis herpetiformis, which is actually linked to celiac disease. But again, this study not so much focused on that, focused on other types of skin conditions: epidermolysis bullosa, pemphigus vulgaris, alopecia areata, which is a form of autoimmune disease. Actually, I've done videos on people with alopecia areata having full recovery, changing their diet. So if you've started to have, plaque-like hair loss across the top of your head, gluten-free diet might be right up your alley. Erythema nodosum and erythema elevatum are different urticarial conditions. I've seen a number of cases of chronic urticaria respond very, very well to a gluten-free diet. So again, if you suffer with a chronic skin condition, you might want to look these things up. Now, I've also seen people with eczema, chronic and chronic psoriasis respond really, really well to a gluten-free diet, and even though those two skin conditions aren't mentioned in this study. Endocrinological manifestations such as Addison's disease, which is an autoimmune condition of the adrenal glands, and then hematological or blood-based diseases like hemolytic aplastic anemia. So when your white blood cell counts are low, your red blood cell counts are low, or your platelet counts are abnormally low, These are all possible and potential examples of blood-based disorders that people with gluten-free diets have tended to respond to, meaning they had this diagnosis, they went gluten-free, and they responded very, very well, and their parameters improved. Uveitis, ophthalmological disorder, which is the eyes. Uveitis is a condition that people can respond to. Actually, there's a video, maybe I'll put a link up underneath this one, of a woman I saw years ago, came to see me with a form of autoimmune arthritis, but one of the side effects was also uveitis, and she was actually getting steroid injections into her eyeball because it was so severe. You know, what it took to make that go away, it took a gluten-free diet in her case. So again, just more confirmation. Also, rheumatological disease. Now, any of you have been following me for any length of time who have read my book, No Grain, No Pain, you know, this is based a lot on my experience in the field of rheumatology and my experience in the VA hospital and dealing with people that had been diagnosed with chronic rheumatological diseases, things like rheumatoid arthritis and lupus, fibromyalgia, other conditions, scleroderma, polymyositis, psoriatic arthritis, spondylo or ankylosing arthritis. So these are just different types of rheumatological disease that I've personally seen in my practice. People respond dramatically well, phenomenally well, in many, many cases full remission as a result of what? Diet change, a gluten-free diet. So again, I wanted to share this study with you. I like to geek out on these kinds of things, and as I was reading it today, I wanted to share it with you because of its emphasis on the gluten-free diet for conditions that are not celiac disease, because there's all this misinformation out there that says that if you don't have celiac disease, then a gluten-free diet is actually dangerous for you. You know, how many times have you read that or heard that or seen a doctor say that? And again, sharing this study with you on going gluten-free in non-celiac autoimmune diseases as the missing ingredient to improvement in health. So this is Dr. Osborne with another research update from Gluten Free Society. Make sure, click to the left and subscribe. Click to the left and go visit us at Gluten Free Society to learn more and check out some more of our videos on the channel. Have a great day. We'll see you in the next video.